So everybody, we are recording. Hopefully when I make Dr. Coffey our host, that'll continue. Let me see. And said, nothing said stop, it stopped. So I think that means it's working, right?
I think so.
Okay, I'm sending you a request and then you should be able to say that I have permission to record it.
Yep, I clicked allow recording.
Excellent. So Dr. Coffey, once you put your, obviously go ahead and put your presentation up when you're ready. But just a quick introduction, Dr. Coffey has been, everybody can hear me still? Okay, so Dr. Coffey was a honor student at Western Illinois University, obviously in the biological sciences. Did you have more than one major? I felt like you might have, or.
I had a couple minors, but just the major in biology.
And I felt like that when you graduated, was it around 2016, 17?
17, yeah.
17, excellent. And then you went, I know you went to Iowa for medical school.
Mm-hmm.
There's a lot of things I remember off the top of my head.
Yeah.
But I have to admit, I don't know what specialty you went into. Are you technically in a residency right now then?
Yeah, so I am in my second year of my pediatrics residency.
Oh, excellent, excellent. And anyway, I really appreciate you being here. We have a lot of students online and faculty. Dr. McPherson is a new faculty member from our department that I see online. She's teaches, or they teach ecology and ornithology. And you might remember Mary Annison. I see that she's online. And anyway, we have quite a few grad students. And then we have a whole room full of students also from the Intro to Health Careers class, as well as seminar students or people that are just interested in the seminar. So, and you probably took Intro to Health Careers too, didn't you, Dr. Coffey?
I did my first semester as a freshman.
Well, anyway, I won't take any more of your time, but if you do run out of time, we're going to be happy to ask you some questions. I know there's an excited audience anyway. So thank you for coming in, or thank you for coming online and visiting with us.
Yeah, of course. Can you guys see my screen okay?
Yes.
Okay. All right. I can't see everyone's faces, so if you guys have any questions, you can just like interrupt me, like unmute and interrupt me at any time, or you can throw your questions in the chat. I will try to keep an eye on it, but I might need Dr. Messer or Dr. McPherson's help with looking at the chat if there are questions. So I kind of split this up into three parts. The first parts are kind of describing like what medical school is like and what residency is like. And then at the time, or at the end, if there's time and interest. Oh, I got a message that says that like not everyone can hear me. Can you guys hear me?
I can hear you.
You can hear me? Okay.
Yeah.
Sorry to everyone. Okay, cool. All right. Okay. Well, I guess the person that can't hear me can just follow along the slides. All right. So at the end, if there's interest, I also have some slides on like kind of like what the application process is like and what like you kind of need to like get into medical school. But I kind of say that for the end just in case there's not time. Dr. Messer kind of already did an intro for me. I'm from Iowa City originally. I went to Western from 2013 to 2017. Like he said, I did the biology medical sciences track and my minors were in chemistry and economics. I went straight from undergrad to medical school at the University of Iowa. I graduated in 5 years. Usually it takes about 4 years to graduate medical school, but I happened to do an extra year just to do research. And then after that, I matched into my pediatrics residency at the Medical College of Cardiology.
Please, everybody, mute your microphones. Chamaka. Can we have everybody mute, please?
So the kind of general path that it takes to become a medical doctor, you need a bachelor's degree, which takes about 4 years. Some people take more than that, and that is not a problem. You have to complete certain prerequisite classes, although you can major and minor in anything that you want to get into medical school, but you just have to take certain pre-med prereqs. You also have to pass the MCAT, the Medical College Admissions Test, to qualify for admission to medical school. Then you do 4 years of medical school, about 2 of which are kind of like in classroom, like lecture hall and small group type learning. And then another 2 years about is experience like in the hospitals, in the clinics, in the operating rooms, kind of getting like hands-on experience practicing medicine and treating patients. During medical school, you have to pass 2 more big exams, step 1 and step 2 of the licensing exam to qualify to match into a residency. And residency, depending on what specialty you go into, will take anywhere from 3 to 7 years. Surgical specialties usually are on the longer side, with things like neurosurgery being the longest training at 7 years. Specialties where you don't have to learn how to do surgery, like what I'm in pediatrics, where I treat children. My residency is 3 years long. There's 1 more step exam of the licensing exam that you have to take to pass residency. And then you also, at the end of residency, have to take a board exam in the specialty that you've chosen. So if you graduate from medical school, you will be, Dr. Lauren Coffey or Dr. whatever with your MD or DO degree at the end of your name, but you cannot practice clinical medicine and you cannot independently care for patients until you complete a residency, pass step 3, and pass your board exam. So you cannot practice medicine until you're a board certified physician. So at the end of those years, 4 + 4 + 3 to 7, you could be done, you could practice. If you want to specialize even further after that, you could do fellowship training, which would be another 1 to 3 years. And that would involve another board exam at the end. So all in all, in total, you're looking at least 11, but up to 18 plus years of school and at least 4, if not more, really difficult exams. So how the hierarchy kind of works in the hospital is that so right now I am the senior resident on a pediatric cardiology team. So overseeing our entire team of doctors is the attending doctor. So he is a pediatric cardiologist and he has been for 10 years. And he ultimately is the one that is liable and responsible for all of the patients and medical decisions that we make on the team. Underneath him is the fellow physician who has completed her pediatrics residency and is now in her fellowship training to be a pediatric cardiologist. And then under her is me, the senior resident. So I'm in my 2nd or 3rd year of residency, and I'm overseeing the team of interns. Interns are residents in their 1st year of residency. They just get a special name called intern. So this is like season 1 of Grey's Anatomy, season 1 of Scrubs, the kind of where you're kind of what you think of when you think of like a medical resident, like they're doing all the scut work, all the really hard work. They're just writing notes, answering pages, running all over the hospital. And then each intern also has 1 or 2 medical students following them. So that is like the kind of hierarchy that the hospital follows. So there's a few different types of medical schools that you can apply to. The traditional medical school that you think of, sorry, I'm getting some pages. The traditional medical school you think of are called allopathic medical school. So this is just like traditional training. At the end of it, you get an MD. If you are pre-med at Western, you will probably also get a lot of like ads and like emails and stuff like that from the Caribbean medical schools. These are also MD programs. They are traditionally a little bit easier to get into than United States medical schools, which can be a good thing for someone that maybe like struggled a little bit with like academics in college, but would still like make a good like candidate for medical school were it not for like admissions requirements. But on the other hand, it can kind of be a bad thing because they will admit a lot of students that maybe do not end up matching into a residency or do not end up completing medical school. So it can kind of be hard to do, although it is still a good program. My friend, Dr. Simpson, here in the bottom right-hand corner, is an excellent resident that graduated from a Caribbean medical school. She didn't tell me that she had a hard time because her school got hit by a hurricane and she had to do some of her training on a cruise ship and then kind of bounced from hospital to hospital in the United States. So it can sometimes be a little bit unstable. There's also another type of medical school, which I had never heard of until I started applying, which is called osteopathic schools. So these, at the end of your 4 years, you get a degree called a DO degree, or a Doctor of Osteopathy. So this is actually an equivalent degree to an MD. So they will do the same 4 years of medical school, and they will do the same residency and fellowship training. So all of my friends in the top right corner, these are all of my co-residents, and they're all DOs. The only difference is that they get an additional 200 hours of training in osteopathic manipulative medicine. I didn't go to a DO program, so I don't like fully understand what OMM is, but it's kind of like at the intersection between like physical therapy and chiropractic practice. Like it's very like massage, manual, like manipulation heavy. To be honest, I don't actually know any DOs that use OMM in their practice, but it is like an interesting, like additional skill that they have. But they do, this is also traditionally a little bit easier to get into than an MD program. And sometimes like historically by like older doctors is kind of like looked down upon as like a lesser program, but in truth, like legally and I think in clinical practice as well, this is like equivalent degree. But to be honest, all types of schools cost a ton of money to go to, unless your parents can pay for it, or you're one of the like 5 people in the country that get a full ride. This is going to cost you hundreds of thousands of dollars. So what is medical school like? This is a real picture of me after my first year of medical school, communicating to my parents how I felt I was doing. It is emotionally draining, and the academics are understandably quite rigorous, and it does take a toll, but there are some fun parts too. So like I said, the first and second year of medical school is mostly didactic or in classroom work. We call this our preclinical years. So you're doing classroom learning, small group learning. You're also in your first semester in the anatomy lab, where all medical students in all medical schools across the country have to learn anatomy by performing dissections on a human cadaver. And this is kind of like the basis for understanding anatomy and physiology as a medical student. The speed and the volume of information that you're kind of expected to learn on a daily basis is a huge step up from undergrad. They often use the phrase, it's like drinking from a fire hose, all of the information that you have to learn. For me, you know, like I got, you know, a 4-year degree in biology and a minor in chemistry. And everything that I learned in 4 years of undergrad was literally covered in the first week of medical school. So all that info is just condensed down to one single week. And so it is intense. The good news is that your grades are honors pass fail. So you're not getting letter grades, or there's no GPA. None of that really matters. So that's the good news. So what is medical school like? Lots of studying after hours. So you're in class like 4 to 8 hours a day. And then you're doing at least 2 hours a day, if not more. And then weekends, you're kind of doing like marathon study sessions. But there's also like some other like fun stuff you can do, clubs, interest groups. There's lots of like advocacy and volunteering type groups that you can do. And lots of people get involved in research when they're in medical school. Like I said, did a research year, then involved in a couple of publications. And I also did some like advocacy type stuff as well. In your 3rd year of medical school, you get to finally start seeing some patients, which is really exciting. So this is when you start rotating through every medical specialty to kind of figure out which one you like the best and which one you kind of want your future career to be in. So when I started medical school, I was like, oh, I think I'm going to be a radiologist or someone that like reads x-rays for a living. And then by my very first rotation, which was pediatrics, I was like, oh, this is the most fun I've ever had. I have to be a pediatrician. And then every rotation I had after that, I just like never had as much fun as I did when I was doing pediatrics. So then I committed to it and applied. Your 3rd year, you're doing a lot of shadowing. So you're kind of like following like the residents and the attendings around to just kind of like see what their specialty is like and learn as much as you can. But you sometimes do get to start seeing patients like semi-independently, like you're still under the supervision of your residents and attendings, but you get to like talk to them alone and like read their chart, come up with a plan. The workload is a little more strenuous. You're kind of doing like 6 to 10 hour days. Sometimes every once in a while you'll do like an overnight call or a 24-hour call just to kind of get the hang of it and get some extra learning. And you are also taking exams at the end of each rotation. So I had to take an exam on each specialty in medicine. And then your 4th year is the best year of medical school, because then you get to do just the rotations through medical specialties that you're really interested in. So I did, I did like an emergency medicine rotation. I did several like pediatrics rotations. I did a really cool like adult liaison psychiatry rotation. There's just like all the fun stuff and no tests. However, you still have to like perform really well at this point, because you need to get letters of recommendation for when you apply to residency. So when I started medical school, I think that I thought applying to residency was just like a regular job interview, but it's not. It's like a really extensive process that I'll get into in the next slide. Also, as a senior medical student, you're also able to do things a little bit more independently. You can start doing procedures like suturing or stitching, maybe lumbar punctures, where you put like needles into people's spines to kind of draw the fluid out to run tests on. And you can kind of, you just kind of know what you're doing a little bit more, which is really nice. When it comes to choosing a specialty, I think the biggest decision you have to make is, do I want to be a surgeon or not? And there's lots of different surgical subspecialties, general surgery, neurosurgery, urology, ophthalmology, which is like eye surgery, cardiothoracic surgery. Like there's tons of different ones that you can do. For me, I thought surgery was really cool, but I just didn't have the physical stamina to stand in the OR for 12 hours, bored out of my mind. And I just didn't care that much about the anatomy and like the technical aspects of surgery as much as I just kind of liked the excitement of it. So I thought I was maybe not cut out to be a surgeon. And then after you decide, maybe if you want to do a medical specialty, you kind of have to decide what patient population do you want to treat. So for most people, it's adults versus kids. So basically, do you want to be an internal medicine adult doctor or a pediatric kid doctor? Or do you want to be an OB-GYN, where you treat pregnant people with uteruses? And the cool thing about OB-GYN is that it's kind of a mix of medicine and surgery, because they're still doing gynecologic surgeries, but then they're doing obstetric surgeries, and they're still doing obstetric medicine and gynecologic medicine. And then there's also the decision, do I want to see patients in my career or do I not? So if you are like a radiologist who reads x-rays, or a pathologist that looks at biopsies under a microscope, you don't have to be directly involved in patient care. You don't have to treat patients or work with them face to face. But for me, I actually ended up, that really was like the part of being a medical student that I enjoyed the most, was like interacting with patients. So I didn't think that I could choose a specialty where I didn't have that face-to-face patient interaction. I also like didn't want to spend my whole life in like a dark room like the radiologists do. Like it's you keep the room very dark so they can like see the x-rays better. It's kind of like a little dungeon down there. And then you also have to consider lifestyle, pay, what kind of hours you want to work when you pick a specialty. This picture right here, this was a gift given to me by one of my first pediatric patients. She drew us a portrait of me with giant glasses and giant ears. And I loved this so much that I kept it forever, and it's still hanging on my wall. So once you decide what specialty you want to apply, your 4th year of medical school, you create your entire application. You send it out to somewhere between 30 and 100 residency programs. And if you're lucky, maybe 10 of them will select to interview you. So you will do these virtual interviews at the residency programs. And then in this computer algorithm, you'll kind of rank them. So you'll rank them from the program you want to go to the most to the program you want to go to the least. And the programs rank their applicants, who they want the most to who they want the least. And this algorithm just kind of like matches you together. And it's actually the exact same computer algorithm. I don't know if this is a rumor, but this is what I've heard. The exact same algorithm that like sororities use to match their like rush applicants is that the same one that the medical residencies use to match their residents. So on match day, it's this big ceremony where in front of your entire classmates, friends, and family, you like open up an envelope and find out where you are going to live for the next 3 to 7 years. And you are contractually obligated to go there once you enter the match. So that is a stressful time. Most people are lucky and match into one of their top 3 choices. I matched into my number 2 choice and I was thrilled to match at Milwaukee. But some people end up matching much lower at their like 10th or 11th choice or something like that. And they have to go there. So I'm just going to take a break. Does anyone have any questions about medical school, what it's like, applying to residency, anything like that? Oh, Dominic.
Yes, how strenuous is both the residency year as well as the residency matching?
Oh, I'll get into the next few slides. I'll get into how rigorous residency itself is. The match itself, depending on the specialty you apply, can be very competitive. So as you can imagine, there's a lot more people want to be neurosurgeons than want to be pediatricians, because neurosurgeons, and maybe deservedly so, get paid a ton. Like they get paid so much. So there's a lot of people applying to neurosurgery and it can be very competitive. Pediatrics is not a competitive specialty, so it's not as rigorous to get into. But every year there can be people that apply to a neurosurgery residency that don't match because there's more applicants than there are spots.
Dr. Coffey, you have a couple people in the classroom that have a question. And
Yeah.
Hello, doctor. I had a question. Is there ever like a case where someone doesn't match into the residency? And then if what happens during that cycle?
So I think this might be changing in the next couple of years, but how it stands right now, if you don't match into the residency of your choice, you can scramble, which is the process where if there's any residencies that didn't fill all their slots, they will take anyone that didn't match into a residency. However, this might mean that you don't get to be the kind of doctor that you want to be. So like one of my friends, the year that he applied, did not match into emergency medicine. So he had to scramble into a family medicine position. Or you can just take a break and reapply the next year.
Okay. Thank you.
we have one more, then we can go back to the electronic ones.
Hi, I was just gonna ask, what type of like clinical experience did you complete before applying to medical school?
Oh, yeah, that's a great question. And I can get to that more later when I talk about like how to get into medical school. But I did a lot of shadowing doctors at McDonough, I think is the name of the hospital in Macomb. And I also volunteered at the wound clinic there. Just kind of, I don't know, I like cleaned rooms and like watched nurses like dress wounds. And sometimes they'd make me like wash old people's gross feet, but it was cool. Did that for like 6 months. And then I also had a clinical research position at the University of Iowa when I was a pre-med, like during the summers when I would go home, where I did kind of clinical research. And I could talk more about that later.
Awesome, thank you.
Yeah. Anzaria?
Hi, I just wanted to ask, what year did you start like taking the MCAT and like applying to different medical schools?
Yeah, so I took the MCAT spring of my junior year of college, and I applied summer and fall of my senior year of college. And I also have like another slide at the bottom that is like a really detailed timeline of what I did each semester. Stephanie?
Hi, you talked about medical school being strenuous. I want to ask if at a point you decide that the stress is kind of getting to you, is there any point that you can decide to take a break and then you come back to it, or you must do your 4 years completely?
So you could totally take a year off. And I kind of did that with my research year. I was like, I just needed a year to do something not as strenuous as medical school. So I did research for a year. You can always drop out. But to take 2 weeks off would not be allowed. You would have to basically take a year or nothing to still stay on cycle with the match.
Thank you.
Yeah. All right. Any other questions, or should I move on to residency? Okay. All right. What is residency like? Surprise, it's also extremely strenuous. Like I thought I knew what was hard. And then I got into my intern year of residency and it was worse. These are multiple pictures of me crying when I come home. That's another picture where a guy thought that I had just gotten off a very rough shift when in reality it started 20 minutes earlier. There are good parts. These pictures. This is me and my co-resident, Dr. Ayi, on our very first day of intern year. And then this is a picture of me on my very last day of intern year after I worked a 25-hour call shift in the NICU. So you can kind of see what a year does to you. Most of my shifts as an intern and as a senior resident are 12 hours long, but they can be up to 28 hours. And you're working anywhere from 5 to 21 days in a row. You're averaging about 80 hours a week. Every once in a while you'll be down to like 40 like regular clinic hours. And sometimes you'll even get up to 120 and you're often working holidays. The work that you're doing, it's the majority of your time is spent in patient hospital wards. So taking care of patients that are admitted to the hospital when they're sick, but you still do a decent amount of clinic time where, you know, people just like go to regular doctor's appointments, outpatient. You rotate through the emergency departments and the intensive care units where like the critically ill patients are. And if you're in a surgical subspecialty, you'll also spend time in the OR. In addition to taking care of all these patients, you're also learning procedures or learning how to assist or perform surgeries. When you're a senior resident, you kind of, like I talked about earlier, manage a team of interns and medical students, and you take time teaching them. So kind of what like a day in the life of what I looked like intern year. 5 a.m. is when I wake up. In pediatrics, we have a lot of themed events where we all have to like get dressed up together. So I'm always wearing something kind of silly because the kids in the hospital like it. I get to work at 6 where I get sign out from the night team. So the night team kind of tells me this is what happened to your patients overnight. And this is what we did. I read all the new like notes in the medical record. I look at their vital signs. I jot down like any new lab work or imaging that they got overnight. Then you can kind of watch the sunrise from the workroom if you're lucky to have a workroom with windows. In this picture, you can see the Milwaukee skyline and Lake Michigan in the distance. And I like to think I could be out there having fun when I'm working. I'll go quick see my patients in the morning. Some of the most common things that we treat inside the hospital, newborns with jaundice or when their skin turns yellow, toddlers that are wheezing from asthma attacks or bronchiolitis, which is like a bad chest cold in toddlers. Teenagers with suicidal ideation get admitted to the hospital a lot. Those are just probably the 3 of the most common things I treat. We also do some small group case-based learning for 45 minutes in the morning before we start rounding. So rounding is kind of the basis of how inpatient hospital medicine works. So that kind of like that pyramid of like the medical team that I showed you. So the attending, the fellow, the senior resident, the resident interns, and the medical students, in addition to the nurses and the pharmacists and the social workers, will round or go around to each individual patient's room, stop at each patient and talk with them and their family about what their assessment and plan is. So this is what I think is going on with the patient, and this is what I want to do about it. And you're kind of like presenting this like 15 people almost sometimes can be how big our teams are. And if you did a good job, the attending will be like, great, good job. And if you do a bad job, the attending will be like, you're the stupidest idiot on the face of the planet. I would never do that. And they will be like, actually, we're going to do this. That takes about 4.5 hours. We also have a kind of conference over lunch where we get learning on, I don't know, asthma, diabetes, you know, just kind of like learning topics for pediatrics. And then the rest of the afternoon, you're kind of doing all your busy work. So you're writing notes, you're placing orders, you're calling consults. If new people get admitted to the hospital, you kind of admit them, or if people are ready to go, you discharge them. Sometimes, you know, someone gets really sick and they start decompensating really quickly. You have to like rush to the bedside and kind of manage that, send them to the ICU or do some sort of procedure. At 5 p.m., you sign out to the night team and you finish any work that you didn't get done during the day. And then I'm usually asleep on my couch early evening because I am very tired. Okay, any questions about residency? All right, how am I doing for time? Oh, not bad. Okay. I think I will move on to the slides about kind of how to get into medical school, since a few people seemed interested, if that's okay with you, Dr. Musser. All right. Oh, wait, I have a few other ones. Pediatrics in general. So there's lots of different ways you can practice in pediatrics. If you want to be like, when you think of the doctor that you saw growing up, when you went to like your well child checks every year, that would be like a general pediatrician. They basically work clinic hours 8 to 5. They might work 4 or 5 days a week. In addition to well child visits, they would manage chronic problems like ADHD, asthma, that kind of thing. They'll probably get a couple appointments a day for like ear infections, sore throats. And there's lots of different ways you can practice. You can do like a rural community versus like private practice. You want to be your own boss and run your own business, or you can work for like an academic hospital. If you want to take care of sicker patients that are admitted to the hospital, you can be a pediatric hospitalist. So this is more shift work plus call, where you might be able to like get to sleep because your residents are running the team overnight, but you have to carry your pager and get pages multiple times a night. So these patients are sicker, you're actively managing their acute illnesses, common things like I already talked about earlier, jaundice, wheezing, suicidal ideation. We also do a lot of pneumonia. Pyelonephritis is a kidney infection, neonatal sepsis. So these are like newborns with bloodstream infections, meningitis is brain infections, seizures we see a lot of. There's also, for even sicker patients, if you want to manage, you can do critical care pediatrics, which would be the PICU, pediatric intensive care unit. So this, you see a lot of like organ failure, respiratory failure, shock, sepsis. And then there's NICU, which is the neonatal ICU. So this is where you manage critically ill newborns and premature babies. This is a cool specialty because you can go to deliveries. And you can do resuscitation on newborn babies. Downside of this is that even for attendings in the NICU, so even at the end of your career, you're still doing 24 to 28-hour calls. You can also work in the emergency room, where you're seeing like the entire spectrum of not sick to very sick. You might get someone that comes to the emergency room with an ear infection, and then later in the same shift, you're getting someone that got hit by a car and is bleeding out. I had a shift in the emergency department last week where I got to do a nursemaid's elbow, which was so fun. So a nursemaid's elbow is when you dislocate your elbow because someone yanks on your arm. So like if you can imagine you're holding your kid's hand and they trip and fall and you try to catch them, their little elbow can just pop out. And I got to reduce it. So I just kind of got to like manipulate the arm, just like pop the little bone back into its joint. And it was so fun. And then like an hour later, I had a kid with a gunshot wound, a 2-year-old with a gunshot wound. It was horrible. So you get to do traumas, you get to do resuscitations, and you also get to see like well kids. So it's like a lot of variety. There's also like more than 20 different subspecialties that you can do in pediatrics. Anything from adolescent medicine to sports medicine, anything that you can think of really, you can do in pediatrics. It's a good specialty to consider if you like working with children. Even if you don't like working with children, it can still be a good specialty for you, because you're still dealing with like the adults in their lives. If you get excited about rare diseases, genetic and congenital syndromes, so congenital means like things that you are born with. It's a really cool specialty because compared to like adult medicine is a lot of managing chronic problems brought on by lifestyle choices. So, like diseases that you get from drinking and smoking and not exercising for 40 years. And I just didn't find those disease pathologies that interesting. I find the diseases that children get to be a lot more interesting to learn about. Okay, any questions about pediatrics? Dr. McPherson.
Hi, thanks, Dr. Coffey. I was wondering, this all sounds very stressful. How do you take care of yourself through all of this?
What a great question. There is like a big push for both medical student and resident wellness. I'm like on the wellness committee for my residency, so we try to organize like events for us all to do with each other to kind of de-stress. like once a month we have a brewery Friday because Milwaukee's like a big brewery city. So one Friday a month we go try a new brewery together. I will say that, it's been studied and published over and over again, like how to improve resident wellness. And the number one thing is time off, which is hard to come by. But it is really nice. I actually just got off a couple weeks ago, a week of vacation, and it was much needed. I renovated my kitchen, had a good time. Just got to forget about work for a while. But it's important to try to remember to eat throughout the day, to sleep well, and to try to have fun when you can. Any other questions?
Hello?
Hey.
Oh, hi. So what would you consider the most rewarding part of being a doctor?
Oh, I really love just like the little interactions that I get to have with my patients throughout the day. And I think this would be true for even if I had treated adults, but like anytime I can just like have like rapport, like connection with a patient, like anytime I can make a kid smile or I can comfort a kid when they're crying. It's not even like the big doing medicine parts of my job. Like I ordered this medicine and it saved this person's life. And it's not as rewarding as like the actual face-to-face interactions that you get to do. And that's what kind of keeps me grounded in my job when I feel like I'm just like drowning in all of the paperwork, documentation, orders, pages, and stuff like that. Like sometimes I'll be like, I just need to go cuddle a baby right now. And I'll just like go find one of my patients and cuddle them for a while.
We have a question here, Dr. Coffey.
Hi.
Can you shed more light on the difference between a pediatric doctor and a neonatal doctor?
Yeah. So to be a neonatologist, you would do a pediatrics residency and then a neonatology fellowship. And so if you're a neonatologist, you're practicing exclusively in the NICU, whereas a pediatrician would not practice in a NICU, but could practice in any other part of the hospital. So they're pretty isolated from each other after you finish your residency training. A neonatologist would be, like I said, attending deliveries and resuscitating newborn babies that need resuscitation, meaning you might have to like intubate them and put a breathing tube in so that you can breathe for them until their lungs mature. You might have to, help manage other of their organs that are not mature enough to function yet. And you kind of keep them alive until their body's mature enough to kind of function on their own. Or babies that are born with like weird like congenital diseases, meaning like diseases that you're born with. So like I think a common one would be like a congenital diaphragmatic hernia. So your diaphragm is that big muscle that separates your chest cavity from your abdominal cavity, and it helps you breathe. And if there's a giant hole in it, your like intestines can come up through that hole and into your chest and stop your lungs from maturing. So that's something that immediately after birth, you would have to take that baby to the OR. A surgeon would do this part, not a neonatologist, but they would, patch the hole up, put the bowels back in their place, and then you would have to keep that baby alive until their lungs mature and fill up the rest of the space. But it's a lot of, so it's critical care level care, but just in really little babies. All right. Any other questions about anything? Okay, I still have some time.
Dr. Coffey, we have one more person coming up.
Okay.
Wait, okay. Hi. I have a question. Like when you pick a specialty, is there a way you can change it or do you have to just stick with that one?
Great question. To pick a new specialty, you would have to reapply to the match and do a new residency. So I know people that have done it. One of this attending I met the other day is an anesthesiologist, but she actually did an entire pediatrics residency and then practiced as a general pediatrician, and then was like, actually, I want to be an anesthesiologist. So then she reapplied to the match and went back to residency and started over as an anesthesia intern. and she's now an anesthesiologist. So it's difficult, but it can be done. And you can do that at any point in your training. Like you can leave residency after the first year to reapply to a new specialty. Like, for example, my friend that tried to match into emergency medicine did not and ended up in family medicine. After his intern year in family medicine, he reapplied and matched the second time into an emergency medicine specialty. So there is a way that you can still practice medicine and switch from specialty to specialty. And that is if you become a physician assistant instead of a physician. So a PA or a physician assistant is a similar degree to an MD, but just a little bit less training. So they do the first year and a half of medical school with us. Like they're in all the same classes. They're learning the same anatomy and physiology. They're dissecting the cadavers. And then they split off and they do kind of more intensive advanced clinical training in a shorter period. And then they graduate in like 3 to 3.5 years. And they do not have to complete a residency. However, you will never practice truly independently. You'll always be practicing under the supervision of an attending, but it's a great way to do similar work with less training. And you don't, because you don't have to do a residency, you can just change at any time. So like one of my friends was a dermatology PA for a few years and she liked that and thought it was cool, but then she just decided to become a surgery PA. So now she's a cardiothoracic surgery PA. So she went from doing derm, like acne and skin biopsies, to like literally hands in people's chests, like assisting surgeries. So you're never going to be like the primary physician. Like you're not going to be performing a cardiothoracic surgery, but you're going to be like the first assistant in it. So PA is a cool job too. All right, so getting into medical school. So there's a certain, everyone's application is going to be a little different because all people are different, but each application has to involve at least these things. Your college transcripts and showing completion, or at least like going to complete all of the prerequisite courses, and I'll get into what those are. You have to include your MCAT score, the medical college admissions test. You're going to have a lot of extracurriculars, which will have to include at least clinical experience. So some experience in a hospital, in a clinic, in an operating room, somewhere in the medical field. Also shadowing. So like just solely you following around a doctor enough hours to know, I like being a doctor. I think I could do that for a career. You also have to do some amount of volunteering, advocacy, some kind of service to kind of just show that, you know, you are a good person that cares about other people, because that's kind of the foundation of medicine. Lots and lots of people do research, but it's not explicitly required. You also need several letters of recommendation, one of which has to be about your experience clinically, not just from a classroom. You're going to write a good personal statement, and then you're going to spend thousands of dollars. I think in total, I spent $4,000 applying to medical school. And that included my test prep for the MCAT, the test itself, and then the money that it takes. Every medical school you apply to costs money to apply. And if you want to get in, you have to apply to like 50, because it's really hard and you got to increase your odds. So yeah, lots of money. The prerequisite classes are both science and non-science classes. You got to do some social science just because there's a lot of social science in medicine, to be honest. You got to do English just to prove that you can communicate well, because that's a crucial part of medicine. You got to do some math. Statistics in calculus not required, but they are preferred because there's tons and tons and tons of statistics in medicine that you have to be comfortable with. Your science classes, you will all have to be with labs. You'll have to take a lot of biology classes. Some schools, but not all, will require at least one of those to be anatomy and physiology or microbiology. And typically that will mean taking even more biology classes than that, because I mean, at least at Western, you had to take intro to bio to qualify to take anatomy, physiology, microbiology. And I assume that's still true. So you end up taking more semesters than that. You have to do inorganic chemistry, you got to do orgo. Some schools, not all, require biochem, but it is a good idea because, like I said, they cover biochemistry in medical school in 1 week. So you got to know it, and it's better if you've seen it before. Physics, 1 to 2 semesters of that. To be a competitive applicant, you will have a 3.7 GPA or higher. The biggest piece of advice that I can give to any pre-med, and this is not to dump on the college counselors because I think that they do a good job, but they are not experts in getting into medical school. They are experts in completing degrees at Western. So if you want to complete your degree at Western and get into medical school, I would like, you know, that book, I don't know if they still do this. They give out like a book with all of the courses that you can take at Western, like a physical book. I would study it and like have my entire degree planned out like semesters and semesters ahead to make sure that I fit in all of my pre-med prereqs and all of my like minor prereqs in addition to completing my degree plan on time. Like I said, you don't explicitly have to complete your degree in 4 years to be a good applicant for medical school. It doesn't matter how long you take to finish your pre-med and your undergrad requirements. But for me, I wanted to graduate in 4 years, so I planned it out this way. I would go into my college counselor like appointments, like being like, these are the exact classes that I want to take. You just tell me how I fit them into my schedule. And that was like how we made it work. But I knew people that kind of got were not as prepared for applying to medical school because they kind of like let the college counselors like make their degree plans that didn't exactly factor in what classes you need to take and when. That being said, you can major or minor in whatever you want. Like some of my classmates had really interesting degrees like English literature, dance, civil engineering. Like you can study whatever you want, but you do have to take the pre-med prerequisites. So you'll either have to do that. It can be easier to just do it as part of your degree plan. That's why I did the biology and chemistry, biology major, chemistry minor, because it was easy and just worked. But I also did that econ minor because I just liked studying econ and I thought the classes were fun and interesting. And that's also kind of what college is all about. So you just got to find what works for you. And I will say there's plenty of people that did their 4 years of undergrad and whatever they wanted to study. And then they would do a graduate degree program or just like an additional year or two of pre-med courses to qualify for medical school. As far as clinical medical experience goes, this is required for applying. I'd say the most common ways to get that experience would be to be a certified nursing assistant or a medical assistant. Unfortunately, this is a certification that you have to take in a class that you have to take for, I don't know, like a month and a half or something. So you have to spend money and time to get the certification in order to practice as a CNA or an MA. But it is very common because it's just an easy way to both make money and get clinical experience. Same with being a phlebotomist, which is like people that like draw blood or place IVs. Scribes are a cool job. So your whole job is just to kind of document. Like you go into like a visit with a doctor while they see a patient, you'll just document for them and write their notes for them. And so it's a really good way to A, get good at writing notes and B, just like watch. And it's also kind of being paid to shadow. It's kind of a cool job. Emergency medical technicians, lots of people worked in ambulances before they went to medical school. Me, like I said, I volunteered in that wound clinic at McDonough. I also shadowed an anesthesiologist and a general surgeon at McDonough. I just like followed them around. I did that like a couple hours a month for several months. And I also did a little bit at the University of Iowa when I was there doing clinical research. Like I said, research in and of itself is not required, but it is highly preferred. I actually did research with Dr. Musser when I was an undergrad. I did it as part of my degree plan too. Like I took a research elective, so that worked out for me. And I also did that clinical research position at Iowa, which was in their pediatric endocrinology department. Volunteer advocacy service. One of these things is it's basically required to do it. The key is to just find something that you like and care about. So for me, I was a peer supporter at the Career Development Center. So I volunteered at the CDC reading people's resumes and helping them like do like mock interviews and apply for jobs. And it's something that, you know, it had nothing to do with medical school or the medical field. It was just cool. And I liked helping people that way and meeting new people that way. In general, quality is better than quantity. It's not good to have just like 10, things that you did for like one afternoon and then never did again. Like no one cares that you like picked up trash on the highway once. It's more important to have things that you do like over and over repetitively or that you took on a leadership role with. Otherwise, it looks like you're just checking boxes. Greek life, admissions committees won't really care if you're in Greek life. If you're the president, they might be like, cool, they can hold a leadership position. But other than that, it's good for maybe like I know that there's a lot of volunteering stuff involved, then that can maybe be decent. College athletics could explain like why you don't have as many hours researching or volunteering because you're so involved in collegiate athletics, but it won't, you still have to do all those other things as well. Lots of people will try to do like mission trips, and I will say nowadays those are very looked down upon because they can be very exploitative. And I won't really get into all that unless you guys want to hear about it, but I would in general don't do anything that is outside the scope of a pre-med, basically. In general, like it's just cool to have something unique on your application. Lots of people ask you about your hobbies, like they really want to know what you're like as a person, and like admissions are really holistic. As far as taking the MCAT, like I said, I spent like $1,000 on my test prep, and unfortunately I do think it was worth the money, because it not only did it come with like 9 textbooks in each domain, but it came with a computer program with lots of practice questions on it, and practice questions are really the most crucial part of studying for the MCAT. Okay, the number one piece of advice for this, just take as few class credits as possible the semester that you take the test. So this is what I was talking about with the timeline. Like I said, my spring of junior year is when I took that MCAT, and I took only 12 credits that semester so I'd have more time to study for it. And then I applied in my senior year. Okay. All right, those are some resources for y'all if you're interested in applying. Just be careful with Student Doctor Network and Reddit because people are really catty and mean on it. Also, don't ever pay anyone to help you get into medical school. That's just a big scam. Okay, other questions?
Well, we have a little time for questions, but I want to first thank you so much for giving this great presentation. Everybody in the room.
Thanks for having me.
We've got time for, I know some people are going to be moving off to class, but if anybody would like to step down for a question or not, or online, please do so. Probably finish up in about 3 or 4 more minutes, but if you do have a burning question, please come on down. Okay, come on down. I have a student that wants to know if it'd be okay for them to email you. Could I give your?
Yeah, I'll have Dr. Musser send out my email in my contact info.
Anybody else have questions or online? Joe has a question.
Thank you.
He's a grad student. He's been doing the medical science track. Thank you.
I don't know where it came from. Hello. I just got a quick for the MCAT. Did you follow us like? So you said you bought a course. Did the course have you should study this, this, and this, or did you just study more on your own?
It did come up with a study. It did generate like a study timeline for me, which I somewhat followed and found helpful.
Gotcha. Which course did you use? If you don't mind me.
I did Kaplan.
Kaplan. Gotcha. Sweet. Thank you so much.
Yeah.
That was an amazing presentation, Dr. Coffey. Really appreciate it.
Yeah.
Unless anybody has a question online, I think I know a lot of kids are rushing off to another class. Do you have a busy day today, Dr. Coffey? I guess obviously.
I was just getting paged nonstop, but nothing too crazy.
Well, thank you. It was like a really great presentation. I know a lot of students got a lot out of it. I see Dr. McPherson's thanking you too, and really appreciate it.
Yeah, happy to be back. Thanks for having me.
Thank you so much. I appreciate it.
Bye.
Bye. Take care. Great job. Really great presentation.
Yeah. Oh, oh wait. Here, I'll let you on.